Welcome, everyone. Going to give the typical few minutes for folks to hop on. So if you need that last minute cup of coffee or anything, go ahead and grab it before we get started. All right. I'm assuming we'll have some more folks coming in. Just trying to kind of gauge how fast people were coming into the waiting room. But I also want to be respectful of everyone's time. So we've got a lot of great information for you today. And you may have noticed that we switched to the meeting format. So that's to help you feel a little more connected and allow things to be more interactive. So we'll talk a little bit more about that in logistics, but just wanted everyone to be aware of that. So this is our McKinney-Vento Community of Practice on identifying and meeting the needs of youth with disabilities who are also experiencing homelessness. And before we get started, would like to invite everyone to introduce themselves in the chat box. So if you could just say your name and pronouns, your district or area, your role, and just a one-word description of how you're doing today. So I'll do mine off mute while people are doing that in the chat and just say, I'm Amanda Wilson. I use she, her pronouns. I'm from COHHIO. I'm the Youth Housing Initiative Director, and I'm admittedly a little frazzled today, but it's all right. We've got a great team and we're all here and gonna keep it going. So invite you to follow the chat as much as you can to see your friends and colleagues and get to know who's in the room. So just our little logistics. So because we are in the meeting format, you can unmute. So as you know, that is both a right and a responsibility. So make sure that you're muted when you're not speaking. If you forget, one of the COHHIO team will probably mute you. So just make sure that you hop off mute if you need to speak. Love to see your faces if you want to share your camera. You can ask questions throughout the training. We ask that you use the chat or raise your hand, your digital hand in the reaction section. If neither of those options are working for you and you need to come off mute, like that's okay too. We're just trying to keep it a little organized. Materials will be sent out as usual. Not doing any breakout rooms today, but we definitely invite discussion. No polls or quizzes or handouts. And the good old AV reminder, if you're having trouble, try logging out and logging back in to see if it's working. If not, and you're able to reach out to one of the COHHIO team, we will try our best to address any audio issues. So our agenda today, as you all do your introductions, is we're going to talk about some identification and enrollment strategies and resources around serving young people with disabilities who are at risk of or experiencing homelessness. And we're also going to do a spotlight on the Child SOAR program, which is a really amazing program that's getting young people with disabilities connected to their benefits, their Social Security benefits. And so we're going to talk more about that. Again, you can ask questions throughout, and then we'll have our closeout. So again, our objectives, talking about identification, enrollment, best practices, and some resources spotlights. Our team, as always, is myself, Ami, and Evelyn, with our generous partnership with ODE. And then, of course, we have our amazing guest speakers today. Emily Durrell, who's a staff attorney at the Ohio Disability Rights Law and Policy Center, Candace at Disability Rights Ohio, and Candace, who is here at COHHIO, doing SOAR Ohio and Housing Now for Homeless Families. And I will let them provide more information about themselves as we get started. And with that, if there are no other questions, the slides, I will see if we can get those posted. Evelyn's going to work on that, and we're going to turn it over to Emily.
Thanks so much, and hello everyone. I'm going to be sharing my screen separately. Hopefully you'll see a PowerPoint. Thumbs up. We got it. Perfect. I'm also feeling frazzled today because it is the end of the school year and my schedule is almost as busy as yours probably is. It's been a bunch of IEP meetings, but today we're talking about students experiencing homelessness and students with disabilities and kind of the special concerns that may exist. So first, I just wanted to introduce myself. Once again, my name is Emily Durrell. I'm a special education attorney here at Disability Rights Ohio. For those of you who don't know what Disability Rights Ohio is, it is the federally mandated protection and advocacy organization for Ohio. So we get federal funds to advocate for people with disabilities or to create tools, the space, the resources people with disabilities need to advocate for themselves. And we also provide information, services, supports for people with disabilities throughout their lives. So I'm obviously on the earlier end of that. I'm in the education sphere, but we also have employment teams. We have social security specialists. We have housing specialists. You ask it, we probably have a resource for you. So feel free to check out our resources on our website. The special education advocacy resources are really good. They're written for people with disabilities. So plain language, if you have students who might benefit from the resources, feel free to share them with the students. That's the audience that our materials are for. And those are the clients we represent. What I do specifically is I represent clients with disabilities in special education matters, focusing on collaborating with school districts, stuff like that. Never adversarial. All right, next slide. This is just a roadmap of what we're going to talk about today. So identification of students with disabilities, services for students with disabilities who are experiencing homelessness. Who is the educational decision maker? This is particularly pertinent if you can't find a parent, which sometimes happens. And then transition planning, just a little bit of information on that because it's really important. So first, let's talk about identification of students with disabilities. So sometimes a student will come to you and you won't have any idea what's going on with that student. They're not doing well academically. There are behavioral concerns. For a student experiencing homelessness, a lot of that may be attributable to the homelessness situation, but that never should be a write-off when you're considering special education. So best practice for special education is evaluate first and then use all that data you gather from the evaluation to make your determination of whether or not they qualify for special education. Only by doing that evaluation are you going to be able to properly determine whether the student has a disability requiring special education services. And part of that evaluation can be looking at their environmental, cultural, or economic disadvantagements. So like homelessness, that's part of the evaluation. You gather the background information. How long has it been going on? How many school districts have they been in? How consistent has their education been? All that factors into the evaluation and will help you tease apart the threads kind of what's going into that student and maybe where they need the supports. So once you perform the evaluation, you'll have a better idea basically of whether or not they qualify. But best practice is evaluate first, take the data, and then tease it apart. A lot of times I see school districts maybe will just write off a kid like, well, there's trouble at home or there's trauma here. They don't need special education, they need social supports, but you won't actually know that until you evaluate. I also wanted to highlight trauma. So a lot of times I've had clients who have had significant trauma in their past. Homelessness is definitely trauma as well. That actually impacts brain development and can really, really negatively impact learning. So impact concentration and memory, emotional dysregulation, hypervigilance, intrusive flashbacks, traumatic re-experiencing. All this is a result of trauma, and this actually can be supported by an IEP or 504 plan. So even if you are getting a student and you're not sure what's going on, you suspect some trauma, or you know there's some trauma, do the evaluation and see if maybe that traumatic, those symptoms of trauma can be supported by special education. A lot of times students can get counseling as a related service through IEPs, which is really great, or they can work on a behavioral goal to focus on coping skills. There's a lot of way that special education can help support our students experiencing trauma. So that's definitely something to consider when you get a student experiencing homelessness. I also wanted to talk about intervention. This is another issue I run into a lot. A school will get a student. Once again, they're not sure exactly what's going on, but they're noticing some deficits. Maybe they're not reading up to par, behavior, maybe they're behavioral concerns, and the school will start intervention, which is great. We love intervention. We love reading intervention. We love it all. But then they will use that intervention as a way to put off the full evaluation. That's actually explicitly prohibited in the law. You can't use intervention as a way to put off your final evaluation. Instead, what you should be doing is do the intervention, but then use that data you collect to inform the evaluation. So let's say you get a kid below average on reading. If you're suspecting a disability, go ahead with the evaluation, give the child the reading intervention that they need, and then collect data. If they improve with the reading intervention, you've done your data collection. Clearly the intervention is working, and you just can continue with that. If they stay the same or decrease, maybe you guys need to look at other aspects or additional services and supports that student needs. That's it for identification. I should have put a stop slide there. Second topic is enrolling students with disabilities. So this is the case where you are getting a student enrolling in your school district, maybe experiencing homelessness, and there's no documentation coming with them. Unfortunately, caseworkers sometimes aren't the best at sending over documentation. Sometimes if a student hasn't been in a school a while, you won't even know where to find the documentation. Your obligation is you got to immediately enroll that student, you know, if they have documentation or not, enroll them in school immediately. And then you also have to start providing a free appropriate education immediately. So sometimes that's difficult because if you don't have the IEP, you don't even know what the FAPE would look like. You have to kind of make an educated guess. You can talk to the student. If you have parents in contact, you can talk to them, reach out to previous schools. And then the next step is you can adopt that existing IEP or implement a new IEP. But you do, that FAPE requirement starts immediately. You can always make up for instruction time if you miss instruction time, but just know that as soon as you get a student, you have to enroll them. That requirement starts, and you got to hit the ground running. And hopefully, you know, by talking with the student, with the parents, or maybe even doing some assessments yourself, you can kind of figure out, oh, the student definitely needs support in this area or this area.
We did get a question, Emily, in the chat.
Yes.
One struggle we have is when our school psych won't evaluate a student who hasn't been at school. Is this an equity concern for homeless students? And what would you suggest we say or do to help advocate for them? I don't know if you have anything.
Yeah.
You're like, yeah, I'll comment on that.
I mean, it absolutely is an equity concern. I think McKinney-Vento pretty explicitly says you have to adjust some of your policies when dealing with students experiencing homelessness, because they're not going to be able to meet all the requirements that you expect of students who are housing secure. So if you have a student who's missing lots of school because they're home insecure, absolutely adjust your policies, adjust your practices, have some empathy for the situation. A lot of times students are also going to be missing school for disability related reasons. Like right now, post-COVID, everybody having pretty severe mental health struggles in school, and a lot of school resistant behavior coming out of all those years spent online. So I think even if the student is missing school because of even if they're housing secure and they're missing school, I still think you should go ahead with an evaluation. But yeah, short answer is McKinney-Vento says, yes, you have to adjust your policies and practices to provide equitable services to those students. Sorry, I'm talking so fast, but the 30-minute limit has me worried. All right, a second thing here about obtaining paperwork. There's actually like some timelines. They're not even specific timelines, but the obligation on the school is immediately you got to contact the student's previous school. Hopefully you know what school that is. to obtain the records. And then special education law actually requires that they promptly respond and you have to promptly obtain records. So there's those words immediately and promptly. Basically, best practices: establish a procedure for your school and how you're going to do that effectively and quickly. So what that can look like is maybe you have a certain number of times you check in with the school, or certain different ways of you try to contact people. A lot of times, if a student is like a multi-systems youth, there are going to be multiple people in their team that maybe have access to IEP paperwork. So if you reach a dead end with someone, maybe reach out to someone else and say, please give us the IEP, with all the releases, of course, signed. And then FAPE, once again, the free appropriate public education has to be provided immediately, even if that paperwork is delayed. So even if you don't get the paperwork, you're going to have to use your best effort to suss out maybe what are the supports that this student would benefit from and try to implement them as much as you can. Next section is, who is the educational decision maker? This is a pretty complicated topic in special education, because sometimes you'll get a student who maybe they're in custody of the state or ward of the state, or they have a guardian, but temporarily, they're in custody somewhere else. So special education, the educational decision maker is actually separate from any custody determinations. It's informed by it, but it's like a separate definition. So we'll start with like the most basic definition. If the student is 18 or over, they are the educational decision maker. They have all the educational rights, unless they are determined legally incompetent by an Ohio court and are assigned a legal guardian. And there's this presumption of competence. So if you get a student and you feel like, oh, the student isn't the best at making decisions, maybe you're worried about cognitive ability, doesn't really matter. There's this presumption of competence in Ohio, unless a court has said, no, this person is incompetent and assigns a guardian, in which case that guardian would be the educational decision maker. For students under 18, the educational decision maker is the parent, and we'll go into all of many various definitions for a parent. But if there's no legal parent, the educational decision maker will be a surrogate parent. Who is a parent? This is basically the law. I tried to write it in plain language. So the first is pretty obvious: biological or adoptive parent, but not in bold, a foster parent. Foster parents are not parents. They're not educational decision makers, and they shouldn't be involved in IEP or ETR decision processes. If you're doing that, you're going to want to look at surrogate parents instead, which we'll talk about on the next slide. The second definition is a guardian authorized to act as the child's parent or authorized to make education decisions for the child. So this is where like a court order would come into play. If someone is court ordered or there's an agreement with the court, this person is the educational decision maker. It's a pretty easy answer. That's the educational decision maker. Another bold not here, not if the child is a ward of the state. So CPS also, they're not IEP team members, and they're not able to make educational decisions on behalf of the child. If Child Protective Services is involved, you also have to get a surrogate parent, which we'll talk about again on the next slide. And then the last definition is a person acting in place of a parent, such as a grandparent, a step-parent with whom the child lives, or a person legally responsible for the child's welfare. Emphasis on that legally. Can you see my mouse? I'm really emphasizing here. Person legally responsible for the child's welfare, once again, with court order. And here's what a surrogate parent is. A surrogate parent is a person who can act in place of the natural parents to make decisions about the school's special education. So you should be assigning a surrogate parent if you can't identify a parent. So you've gone through that list on the previous slide and you're like, well, no one fits this definition. Or you cannot locate a parent. So sometimes you just can't find a parent, in which case you need to assign a surrogate parent. Third is if the child's a ward of the state, Child Protective Services, DYS, you got to assign a surrogate parent. And then fourth, child is an unaccompanied homeless youth. Got to assign a surrogate parent. And the definition for unaccompanied homeless youth is a youth not in physical custody of their parent or guardian, and meets the definition for homelessness. So if someone's living with parents of a friend, that meets the definition there. And then surrogate parents also have to complete the Ohio Department of Education training for surrogate parents. And some more info here on who cannot be a surrogate parent. This is something else that I unfortunately see all the time. You cannot be a surrogate parent if you're an employee of any state, local, or any other public agency that is involved in the education and care of this child. So teachers cannot be surrogate parents. I have like more information here. Yeah, the surrogate can have no personal or professional interests that conflict with the child's interests. And they also have to have sufficient knowledge about the child to adequately represent the child in educational matters. So if your school district has a teacher or an administrator that acts as your de facto surrogate parent, that's actually an improper practice. There's conflicting interests there, and they work in the school, they work in the education or care of the child. They cannot be a surrogate parent. Instead, maybe look for someone in your community who maybe is an advocate themselves. You also want to make sure that they know stuff about the child before they represent them as an educational decision maker. I've gone into meetings where the surrogate parent rolls in and they've never spoken to the child. They know nothing about the child's case. And then they're making pretty high impact decisions on behalf of the child about what instruction they should receive. Please make sure your surrogate parents are reaching out to the student ahead of time, at least to, touch base with them, learn about their likes, dislikes, maybe get a good grasp on what supports they do need. We don't want people making educational decisions that have no idea about what the child's actually going through. Another thing with unaccompanied homeless youth is you can actually give them a higher level of independence in the educational process. So communicating with them about, this is your IEP, here are like the IEP deadlines, keep them in the loop with their educational rights. Oftentimes the unaccompanied homeless youth they're already going to be pretty independent. So, support that advocacy, support that independence as much as possible in the special education process. And then if you want more information on the surrogate parent conundrum, you can check out our FAQ. ODE, Ohio Department of Education, also has a lot of good information on the surrogate parents. And we actually wrote the new training module, which is why I'm emphasizing it a little bit, but it's a really important element of children with disabilities. Here's just some information identifying the parent. So once again, this all goes back to these court decisions, basically. So biological or adoptive parents can still have education rights, even if their child is in custody of another entity. So there's temporary custody, there's, I don't know, every county in Ohio does their own thing. There's a myriad of options. So you're gonna want to get your hands on the custody decision and really be sure about who has the educational rights there. You may want to review the custody decision with your legal counsel just to be extra 100% sure. But if custody is ever in the air, I always recommend reading the actual court agreement and making sure that, maybe there's a biological parent who still has that right. You just don't know. You got to double check. Any questions on that? I'm not seeing anything in the chat. I'm just doing so well. All right, so the next thing is contacting parents. So with my line of work, I work a lot with families and their students. I'm like a client-facing attorney. I know how difficult it can be sometimes to contact parents, especially parents experiencing homelessness. Oftentimes, maybe they don't have a consistent place to charge their phone, or I've had parents work in the night shift, or they work 2 jobs. It can be a real struggle to get a hold of people. So these are just some tips that I've developed over the years. The first is using multiple lines of communication. So I notice a lot of times schools will rely pretty heavily on, oh, we have the school app, Schoolology, that'll be our communication thing. Sometimes that's inaccessible for the parent. Usually the most accessible is text messaging, I found. But the issue, of course, with text messaging is there's not really a record of it. So if you are going to go the route of text messaging, you can try, I've seen apps that you can put on like your school computer that will keep records of all the texts. That way you're also not using your personal phone. There's lots of ways kind of around the barriers of keeping track of communication. Something that I didn't write here that I do also recommend is keep a record of any time you reach out to the parent and when are they responsive. That'll give you an idea of when are they available and what communication methods work best for them. And then you can kind of extrapolate from there. So like when I'm reaching out to parents, sometimes I'll send 50 emails with no response, but I leave one voicemail and they're calling me within an hour. So that's good information to take down. Another really useful trick is to schedule calls in advance. So you can text a parent or email a parent, whatever way they communicate, say like, hey, are you available 10 a.m., whatever, add it to their schedule. Sometimes parents are not going to be available all the time, especially if they're working those crazy hours. I've had a parent who was home insecure who she could only take a call while she's in the library, and she's only in the library, 10:30 on a Thursday. That's when I was calling her. Be flexible about when you're contacting them. I've called parents at 7 p.m. and 7 a.m. I don't like it, to be honest. Like, I'd prefer to work within my working hours, but when you're working on ensuring that people are getting the services that they deserve, you have to be a little flexible sometimes. And then you can also let the parent know where they can find you in person if needed. A lot of parents may struggle with technology. I know you guys probably don't want parents showing up unannounced at the school. I know that sounds scary, but maybe if there's a receptionist, you can bring a note to the receptionist, or if you have any concerns, this is how you contact us, this is who you see. Having some sort of plan, a point of contact for the parent can be really, really helpful. Oh, we're almost at the end. I did so well. Okay, transition planning. This is just a real brief section. I wanted to really emphasize this because transition planning in Ohio starts at 14. If you're getting any students 14 and older, you really need to be taking a close look at their transition to adulthood. And you as the school are in this fantastic position to link the student to tons of resources that maybe they wouldn't otherwise know about or be able to be linked to. I should have put SOAR program on this list. But the first thing here is OOD, Opportunities for Ohioans with Disabilities. They provide vocational rehabilitation services for students with disabilities starting at the age of 14. It's a fantastic program. And for some reason, no one I talked to ever has even heard about it. So please look into it. They can provide job training on the job site. They can provide, they can pay for like college stuff. There's so many things that they can do. And if you can link students to them early, especially your students with more severe disabilities, you can definitely improve their outcomes for adulthood. Other resources you can link to, this isn't exactly transition related, but Ohio Rise is kind of a newer program in Ohio that provides specialized managed care program for youth with complex behavioral health and multi-system needs. I think their program is pretty admirable. So if you could get them linked, the schools can do that. County Board of DD, sometimes I run into parents who their student absolutely could benefit from the waiver services provided by the county board, but for whatever reason, they're not linked. You can always make that connection. For your technical schools, college prep, other local resources, as the school district, you know what's available in your community and you can help the student get linked to that. And then SOAR program, I'll put right there. Vocational support, just emphasis on this again. It starts when you're age 14 or over. If you have any issues with OOD, with getting the student the services, our organization provides the client assistance program that helps kind of negotiate and advocate in disputes with opportunities for Ohioans with disabilities, if that ever comes up. Oh my God, and that's it. Any questions there?
That was amazing.
Thank you. I tried my best. I will say this is obviously a very wide overview of these concerns. Like if you have nitty-gritty questions, feel free to email me. I put my email up here. I didn't even touch on transportation, which is a huge issue as well. So there's definitely more to it than this, but hopefully this gave you a good introductory overview of special education concerns for students experiencing homelessness.
Thank you so much. I think we're ready to, got lots of very helpful comments and great information comments in the chat. So thank you so much. And I think we're ready to switch back to our slideshow
Yes.
and
Wait,
turn
so
it
I
over
stopped
to
sharing.
Candace.
Perfect. All right, Candace, take it away.
Thank you so much.
Okay, hi everybody. I'm Candace Talty, and I am the SOAR Ohio Director. I'm also the Housing Now for Homeless Families Director. Just a little bit about myself. I absolutely love SOAR. I've been doing this for about 10 years now. I started as a case manager with a local agency, and it was something that really stood out to me, that this is really needed and it's a really big help for the people that need it. So I'm excited to be here. I love what Emily said, the different things that she has to offer. One thing about SOAR for Children here in Ohio, it's rather new. We are just starting to really focus, implement, and train our specialists to do SOAR for Children. So we're excited to get that started. I'll give my information at the end. So if anybody's interested in, you're more than welcome to call me, ask any questions that you want, and maybe get, yourself certified to do SOAR for Children. Next slide. Hold on. Sorry. Go ahead to the next slide. Just a couple housekeeping slides that I have to go through. This is our COHHIO bubble. If you guys are probably familiar with COHHIO and all the different things we do, and SOAR plays kind of a little bit of a part of that. So we're excited to be with COHHIO. Go ahead to the next slide. One of the disclaimers is SOAR is sponsored by SAMHSA. So this is something that I have to read through. The views, opinion, and content expressed in this presentation do not necessarily reflect the views, opinions, and policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. Next slide. The next two slides are just kind of thank yous to our sponsors. Right now, SOAR Ohio is being sponsored by Ohio Department of Mental Health and Addiction Services. And on the next slide, you'll see that we're also sponsored by the Ohio Developmental Disabilities Council. We're really thankful for all their support. They think SOAR is a great program and that it's really helping those that they serve. Next slide. And then this is a SSA disclaimer. The information presented in this webinar is accurate and effective as of calendar year 2023. Participation in this presentation does not constitute an endorsement by the Social Security Administration or its employees of the organizations, and information and products not provided by SSA. That's all I have to get out that they make me say. So moving on. So what is SOAR? SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. So if you know anything about SOAR, we strongly put out there that we're not just doing Social Security applications. We want to help the clients that need our help in all the areas that they need it. So first, we're going to get them the Social Security benefit payments that they might need. We're going to try to outreach with them to find out ways to help them to maybe get into housing, get other assistance that they needed. The same with access. Do they need different things? Do they need medical care? Do they need the housing? Do they need help in schools? All that is going to lead to a recovery, not so much as an addiction recovery, but a recovery of being homeless, being on the streets, being without those different things that they need. So this is what SOAR stands for. And this just kind of lists a couple different things that SOAR is associated. We're a model for assisting eligible individuals to apply for Social Security. I don't know about you, but if you've ever looked at a Social Security application, it is very demanding. It is a grueling process almost. And for somebody who's already experienced homelessness and other different things going on, it might be a very hard challenge for them to do it. Many of our clients come and say, we tried this on our own, we just couldn't do it, we didn't understand, we have so many other things going on. That's where the SOAR provider can come in and say, you know what, we got you covered. We know how to do this. We were trained how to do this. Let us help you. Let us help you reach out and to get some of these other necessities that you need. So that's what SOAR is all about. Again, we help those that are experiencing homelessness, at risk of homelessness, whether you have a mental health disorder or a physical health disorder, any type of disabilities, we're willing to help you sort through the Social Security process and get everything situated so that you present an application to Social Security that's complete, that's well done, and hopefully is going to be awarded benefits on that very first try. We're in all the 50 states. I believe this year we started even in, excuse me, Puerto Rico. So we're really excited about doing all that. Next slide. This is just a little bit of more. We're a methodology for completing the SSI and SSD applications. I tell everybody we cross all of our T's and dot all of our I's to get that process done. Hopefully the first time, and then we get our clients situated with benefits coming in to help support them. We're interactive with the clients from the start to the finish. We do know of several other organizations or processes with doing Social Security where they may only get the applicant in the door, get them, maybe that first page done. We do the entire process with them, start to finish. We do all the paperwork with the client so that everything is turned in and presented as a full application so that Social Security or DDS is not looking for anything else, which can waste time. We want to get these done quickly and as accurately as possible. And then we try to connect the individuals with other needed assistance. So maybe you're in an agency that can provide housing. How can we connect this person who is homeless, who's just applied for Social Security benefits? How can we help them find housing? Maybe they need health care that's not covered yet. Just different things. We put that all together so that they can move on from homelessness. Next slide. So what is SSI for children? We know that there are two different Social Security programs, the SSDI and the SSI. SSDI are generally for people that have worked, who had made some kind of effort to work, make an income, have earnings for several years at a time, whereas SSI is basically just for individuals who have very little work or no work at all, which would be children. Children are eligible for SSI, but I will say there are a few children that can apply for SSDI based on their parents' income or different things. But overall, SSI is what children will get. And we can see that, this is going to provide them with other resources. Almost all SSI cases are going to provide Medicare. So we're not only providing a stable income for that child's family, we're also getting them involved in Medicare and getting some of those medical needs covered. There's a difference in the eligibility criteria between adults and children, and I'll kind of get into some of that because like I said, we're just kind of knowing SOAR for children a little bit better, but it's definitely a great program. So we want to compare the two and see how we can implement. And right now, even for children, the monthly benefit for SSI is going to be $9.14 a month. Next slide. So why SOAR for children? We know that children and younger people and the youth, they experience homelessness and they're having a higher rate of mental health issues because, their developmental delays, their poor cognitive outcomes, and all of this can kind of build up. And this is going to prevent factors that other children who are in stable housing aren't going to affect. So we need to specifically address children and why they're going through this, what's causing them the difficulties, what are the disabilities, and how can we help them? Go ahead, next slide. Make sure, okay. This is just some statistics that we found out. It's a little bit outdated. It was done in 2020, but we found out, and this was from our own Ohio Balance of State and Continuum of Care reports, that 577 homeless families, and of all of those, 1,900 with children. So we can kind of guesstimate that that's about over half of these children are under 18 years old and they're living on the streets. And we're Ohio, that was for Ohio. And then Ohio is kind of on the national level where up to 60% of those facing or experiencing homelessness were under 20. So under 18 years old. So that's a big factor for children to face. 60% are under 18 and they have no place to call home. And then unaccompanied youth are more likely to be unsheltered than those experiencing, than all the people experiencing homelessness, sorry. Oh, go ahead, I'm sorry. So we're going to talk about some of the benefits for the individual receiving Social Security benefits, but this is just a couple slides about the benefits to the state and the different communities. And we know that Social Security now, I think it's been since 2013, if you get Social Security benefits, if you get SSI, you're going to automatically get Medicaid. So right there, health providers are going to be able to reassess the cost of their uncompensated care. So generally, when somebody who doesn't have health care and they do have a medical problem, they're going to head straight to the emergency rooms. This is going to help start covering some of that. With SSI, if you start to receive it, then you get the Medicaid, it's going to go back a couple months. So anything that you've had, any kind of medical treatment in that time, these hospitals, these doctors can recuperate that cost. State and localities can recuperate the cost of public assistance. So if somebody is getting public assistance, SSI is going to help cover some of that expenses. And then the cost and back payments received by individuals in local communities, and this is statewide, and this is only through what we've done through SOAR, has been $570 million. So if you could imagine all of that money going back to recuperate cost of healthcare, of general assistance to the public, it's a big deal. It's very, we're very proud of that amount. And this, again, this is only what SOAR has done. This doesn't include anybody else who's doing any kind of SSI applications. Okay, so kind of the basics. SSI is for low-income individuals. It's for children who are disabled and blind. Again, the benefit for this year is $914, and it provides medical assistance. So let's kind of get into the eligibility based on SSI alone. SOAR is totally based on the requirements, the regulations of SSI or SSDI, basically of Social Security. So this is what Social Security is saying, that for children to be eligible for SOAR, they have to have a diagnosis. The little blue, oh, it's green on here, I think. The little line down there, it'll be a link to the blue book. So if you have a diagnosis and you meet what we call the blue book, so this is a listings of everything that Social Security will cover. That's your first step. The second step would be the documentation. So this means that we have to have firm documentation from a doctor, a psychiatrist, a hospital, another bona fide medical source to make sure that this client does meet that qualifications as a medical or physical health disability. And then the duration. We need to know that their disability is pretty much a permanent one. So it's going to last for 12 months, has lasted for 12 months, or unfortunately for some of the more serious ailments, it's going to end in death. So all three of those things is what we need to look for first to make sure that this child is eligible for SSI. And then we're going to kind of combine that. What is their functional impairment? So SSA is going to look at that medical information, and then they're going to look at the functional information to see if this child's abilities is comparable to the functional abilities of a child the same age who does not have a disability. So this is where I guess we could say the big difference between adult SSI and child SSI falls in line. Because with adult SSI, we're just kind of looking at the whole picture of all adults across the board. Whereas children, we're going to look more in depth to their age and to children of the same age without a disability. Okay. And then we cannot do that in a little bit of a different way. This is called our sequential evaluation, where we take these 3 steps to determine if a child is what we say is at SGA level, at SSI eligibility, and eligible for receiving funding. So we kind of look at, is this child working at SGA? SGA is substantial gainful activity. So we know that in most situations, children aren't going to be working. They're not going to be able to come up with SGA. And that way they're automatically moved to the second step. If by chance they are, I don't know, I've never ran across a child receiving more than SGA, but maybe they have a trust fund or they're a famous actor or something like that. They might not quite meet that criteria right there. So we're going to move on to the next step. Does the child have, does the child have a serious or a severe impairment? So we're going to go back to that listing. We're going to look to see, is this in the Blue Book? Is this something that Social Security covers? One thing we do get a lot of misconceptions about is some people would think, well, my child broke their arm or they broke their leg, they're going to be laid up for quite a while. More than likely, that physical impairment is going to heal. It's going to heal properly. That's not considered a disability in the eyes of Social Security. So even though we get those questions, we want to make sure that we're, something that's going to last a long time. So if no, then, automatically it's not something that SOAR is going to work with. Usually we will just kind of send them back to Social Security or suggest, maybe they try something else, but it's not going to be a Social Security issue. But if yes, we're going to look at, does the impairment meet or medically equal a listing? So we're going to go again to that Blue Book. Does the child have all the criteria that meets the listings of Social Security? If yes, then they're going to be approved right then and there. If not, there's going to be a denial, and we can maybe do an appeal or think of other ways to help this family and this children get the funding that they need.
Hey, Candace.
Yeah.
We did have a question. Is there a pamphlet available about SOAR that's parent friendly? Is that something we have or something that could be coming?
It could be coming. We don't have that right now. Are they wanting more information about it or something they can share with the parent?
Something they could share with a parent.
Yeah, we do not have something like that, but there is a few things online that might be helpful, and that would be at the soarworks.gov website.
Okay, I can put that in the chat.
Thanks. Does that
Thanks.
answer the question?
I think so.
Okay. Go ahead and move to the next slide. Okay, this is just kind of a repeat of what we said about SSI eligibility. You have to have a serious or physical impairment. It has to have lasted or expected to last for 12 months or maybe sadly end in death. And then the medical illness or mental health illness, must have documentation of medical criteria and mark limitations. And these are kind of the 4 areas of functioning that we talk about a lot. Now go to the next slide. These are both for adults and children, and it kind of gives the adjudicators, so this is going to be the person that's processing the claim, an idea of what the child or the adult is dealing with. How are they reacting to things? So the first one would be the understanding, remembering, and applying information. How is their memory? Do they forget very easily? Can they follow the directions? We take all of that into consideration when we're working with the mental health side of things. Are they interacting with others well? Is it a normal process? Do they show a lot of anger? Do they avoid being around people? The next one is consistent, concentration, persistent, and maintain pace. Can they complete tasks at a time in the length of time that they should be completing it? Or do they have, a hard time focusing on details? Are they distracted easily at work? How does all that affect their mental functioning? And then adapting and managing oneself. Are they keeping themselves clean? Are they responding easily to change? And do they set realistic goals? Or are they, kind of just out there and just, talking things that really are unrealistic for them, or things that aren't really true? This is all going into consideration when the adjudicators try to determine if this person does suffer from mental health issues. So we keep that. And then for children only, we also have an area that's called 6 domains of functioning. So when they consider everything that we're putting into the application for children, we have to list those areas of mental functioning, which we just go over. But then for children, we add 6 more little bit areas to be a little more detailed. And this is where Social Security will put maybe an extra focus on comparing the children by their age, whereas with adult, it's all the same across the board. If you're 18 or over, you're considered the same as adult as a 65-year-old. Whereas to children, we take a little bit more detailed into it. So we're going to get into that. Go ahead to the next slide. So one of the keys for doing the child SOAR application, or even just a child SSI application, is we're kind of taking that whole child approach, and we want to recognize that there are activities that use more than one of the abilities described in these 5 domains. And then the last one, as we'll talk a little bit about, is more of the physical demands that the child will face. So go ahead and go to the next slide. We'll kind of touch base on these real quick. Am I okay on time, Amanda?
Yeah, we've got about, we're a little less than 10 minutes. So yeah, 5-7 minutes would be ideal.
Okay. So the first step for the 6 broad domains is just inquiring and using information. How are they learning? How are they accepting new information? And how are they applying that? Number 2 is attending and completing tasks. Do they keep up with the pace of everybody else? Are they carrying out tasks? Are they doing, things in order that need to be done? Interacting and relating to others. How are they getting along with other people? Even though a child may be very shy and they don't, necessarily go out and talk to a lot of people, are they doing that in an average way, or is there something a little bit more going on? Moving about and manipulating objects. This is kind of where we get into the fine motor skills, the gross motor skills. Are they in school? Are they having trouble using scissors, using a pencil? These are the things that we really want to, concentrate on when we're looking at those motor skills. Caring for themselves. Children are children. We, constantly have to get after them. Did you do this? Did you clean your room? Did you wash your face? Did you take a bath? But is it to the point where it's an excessive reminding of them? A lot of children with mental health disabilities, they might not do some of these things. So we want to make sure that we're looking forward into what they're doing with that. And then number 6 is a little bit different, because this is your health and physical well-being. How is all this coming into play? And, how are I'm sorry, I'm just losing train of thought. How are these being shown in their physical actions, in their physical mental thoughts? Are they making these things presentable? So these are all things that, in addition to those 4 other areas that we have to provide, we need these for the children. And I think if we can go to the next slide real quick, I can kind of, this would be the actual disability report that we turn into Social Security. With SOAR, we do a lot of things paper-wise, or we type it up. There are a few things that with SOAR we can do online. The child disability is one of them. This is the SSA 3820, and it just is for the child, if possible, the parent, maybe a caregiver, a teacher, somebody to fill out who knows that child, who can answer these questions. And these questions are kind of basic questions. They're going to ask, where is the child living? Just where they're going to school, different things about their age, how do they respond to things. And then once you get this done, you will go into something called a child function report. And this is where it gets very detailed with the children. Adult function report, the same across the board again, 18 to 75, whatever, it's the same. But with a child, we break it up. I believe it's 4 different areas. So we have for ages 1 to 3, and then from 3 to 6, from 6 to 12, and then 12 to 18. Because if you have children, you're around children, you work with children, you know that there are significant changes, significant growth spurts, different things that are happening with this child among those ages. So Social Security wants to be really clear on how they look at a child and make sure that they're giving that child the consideration according to their age. So we don't want to compare a child that's 2 years old to a 16 years old. We know right off there's going to be a lot of differences. So Social Security is really good about making those comparisons. And that comparison sheet, I don't have that one up there, but that function report can be a holistic approach. The parents can do it. The teachers can add to it. Maybe the doctors or the medical providers, anybody involved in the child's life can make a difference in completing that report. Go ahead, Nick. This is just about the online course. I'm trying to speed it up a little bit, but it kind of goes through everything of how to get involved, how to take that first step if you want to work with children and doing Social Security benefits for them. We have on the website, the SOARworks website, they have all this information. It'll give you a full and complete guide to doing the course. The course takes, they say, about 20 to 25 hours. I know everybody's busy, and that sometimes isn't realistic to think about it. So it might take you a little bit of time to do it, but it's well worth it if you're thinking about doing SOAR for children. It gives you all the information. You'll have like little practice cases of what to do, how to fill out the forms, and you can go from there. And as always, I'm here. I work with a great partner, Erica Copley, and she's here. We can help you with it to get through it. You do get 20 CEUs for doing it, so that might be an incentive. Go ahead to the next slide. Again, this is just more of how to get started. Feel free to contact me. I'll be happy to help you get started, give you any more information that you need with this. All the benefits that Social Security would be to families, and how SOAR Ohio itself is just kind of ramping this up. So we'd love to have you on board with us and go from there. If you have any questions, like I said, always reach out to us. We're here. And then I did have a little slide. This has about 3 minutes. Do we have time for that, or is that something just to leave them to do on their own?
Yeah, we'll let them do it because they'll get the materials, so they should be able to click on that.
Okay, yeah, it's just a cute little cartoon that kind of walks you through what SOAR for children is all about. And then here's our contact information. Any questions? Did you find any more coming up, Amanda?
No, thanks, Candace. Sorry if you felt rushed, but that was like really great information. I appreciate you getting some thank yous in the chat. I know we've got just like 1 minute left, but I just like to draw your attention to the feedback survey in the chat. Please fill that out if you are able to. And then, of course, the end of our slideshow is our usual, just reminding you that we are available at COHHIO to provide technical assistance. yes, the, if you go to that SoarWorks, sorry, we got a couple questions coming in, about the online course, that's on that SoarWorks website, right? Candace? Yeah, okay. Oh, and then, connecting to housing. So, the question is the focus the housing, or is the focus the benefits? And I think the focus is getting the benefits. Candace can correct me if I'm wrong, but it's targeted to people who are having that housing instability and risk. And so the hope is that through these connections and services, they're also having positive housing outcomes. Did I say that right, Candace?
Yes, yes, that's exactly right.
Okay, great.
Yeah.
All right.
And for anybody who need anything, like I said, my information was on there. Sorry, I was muted when I was trying to talk. But any questions you have, feel free to reach out to me. I'm trying to read through them. But I think you covered most of them.
Okay, great. And yeah, as always, we welcome your feedback. If you need to get on the mailing list, or you know someone who does for Course to Home, let us know. And I just really appreciate everyone's time and attention today. Another big thank you and round of applause to our speakers for today, and just appreciate you being here. And if you have any questions or need anything, please don't hesitate to reach out. And I hope everyone has a wonderful rest of the afternoon. Only 1 minute over.
Thank you all so much. Bye-bye.
Thanks, everybody.
Thank you.